Diagnosis and treatment of hyperthyroidism. Hyper means excessive. Excessive production of hormones T3, T4 by the thyroid gland is termed as hyperthyroidism. So this condition is considered as an abnormal or pathology. It is a disease which produces abnormal symptoms within the patient. Diagnosis is from the physical examination of the healthcare provider. There is exophthalmos, skin changes. Then next is the cardiac complications like atrial flutter, fibrillation, hypertension, irritation, irritability. These are the various symptoms produced by the overproduction of the T3, T4. T3 is the active hormone which is produced within the cells of the organs by the conversion from the T4, which is converted into active form T3. Only the least quantity of the thyroid hormone is present in the blood in free form, which enter the tissues and organs to produce the energy in the human body. So, diagnostic procedure, blood examination, estimation of the antibody which are produced by the immune system against the tissues of the thyroid, that is IgM, IgG. These are the antibodies estimation indicate the degree of the pathology of the hyperthyroidism. Next is the estimation of the blood level of T3, T4 in free form, and also thyroid stimulating hormone produced by the pituitary, estimation of the level of these hormones. In hyperthyroidism, primary hyperthyroidism, there is excessive elevation of the T3 and T4 in the blood and lowering of the thyroid stimulating hormones in the blood. So the level of the thyroid stimulating hormone is decreased, whereas the T3 and T4 are elevated in primary hyperthyroidism. Next diagnostic procedure is radioactive iodine, which is taken orally, and uptake of this radioactive iodine is assayed or estimated. That also indicate the severity and the degree of the pathology or the disease in the thyroid hormone. But this has some side effects, especially the liver toxicity is produced in certain patients. The most safe and time-honored is ultrasound. That is, sound waves are used for the detection of the nodules which are toxic and non-cancerous nodules which are responsible for hyperthyroidism, which are present within the normal tissues of the thyroid gland, and they are the self-governing autonomous nodules which are responsible for over-secretion of the thyroid hormones, producing the hyperthyroidism. So, by ultrasound sound waves, we can detect the interior of the thyroid pathology, but it is a safe one, especially in the pregnant women and also the lactating females. Now the treatment. So the treatment is basically that you have to limitize the normal limit or intake of the iodine salt in the form of food, seafood, and also the oral or the tablet form. Now, in addition to this, there is propylthiouracil and the carbimazole, but the propylthiouracil has side effects over the liver tissues, so this is not used nowadays. The only medicine which is used, that is carbimazole, 10 to 20 milligram BD dose, but it is a treatment which extend from months to years. So it is a prolonged treatment. Next is the radioactive radioactive. Next is the radioactive iodine. This is used to destroy the nodules, abnormal nodules, producing oversecretion of the thyroid hormones, and these also, damage the normal tissue, surrounding tissue of the body and the thyroid, because there is due to radioactivity radiations. Finally, when the medical treatment fails, does not produces fruitful or the required results, then we proceed towards the surgical process, that is partial or the total removal of the abnormal thyroid gland. Partial means that is the non-toxic nodules, they are removed by surgery, and when it is not cured by the partial surgery, then we have excised the total, all the or whole of the thyroid gland from the body. But this produces deficiency of the normal demand of the thyroxine, thyroid hormones T3, T4. So we have to advise the patient to take synthetic thyroid hormone, that is thyroxine, in the form of levothyroxine. But this treatment is lifelong one. Throughout the life, the patient has to take the synthetic hormone of the thyroid to maintain the function of the and metabolism of the human body.